What if there was a disease that could turn your body to stone? Well, there's a disease, takes your connective tissue like your cartilage, and it begins to turn it into bone or ossify it. These pictures show us a skeleton where this has happened progressively. The tissue in the neck, the back, and the shoulder, all of that has begun to ossify. This picture shows the scapula with connective tissue ossified in between to where this person can no longer move their arm. It's called Stone Man syndrome. Its actual name is fibrodysplasia ossificans progressiva. This just means that progressively your fibro or cartilage tissue is going to ossify into bone in the wrong way. Muscle tissue and connective tissue, such as tendons and ligaments, are gradually replaced by bone or ossified, forming bone outside of the skeleton. Episodes of inflammation and sudden muscle growth, sometimes from a fall or illness, and unfortunately, this is worsened by medical procedures. In other words, if someone were to go in and try surgically to remove one of those bones, the area becomes inflamed and it begins to heal, and when it heals, it ossifies more. So you cannot surgically fix this. It's caused by a mutation in the ACVR1 gene, a gene responsible for the ossification of cartilage to bone in normal development. It happens in a very controlled way, but in this case, there's a spontaneous mutation or hereditary factors. The very first sign of Stone Man syndrome is actually that the big toe is going to turn inwards. And you're going to see that in a child, and then the other symptoms of the actual cartilage turning into bone won't happen until they're much older, and then it progresses through their lifespan. All right. Now that we are on the topic of bone, we are starting chapter 7. Your skeleton is composed of living tissue. We are typically very used to seeing that skeleton in the corner of the classroom, and it's just dead. But inside of you, you have a living tissue skeleton. Your skeleton actually interacts with the organs around it. It can store stuff like calcium and then bring it out and give it to the body when it needs it. It's continually rebuilding itself all the time. You're breaking down your bones and you're building them. It's really a living, amazing organ. Other components of the skeletal system include cartilage, which is a semi-rigid connective tissue, and ligaments and tendons. This is dense, regular connective tissue. On the right here, we see a skeleton. Hyaline cartilage is shown in blue, and it is located at all of our places where our bones connect. All of our joints typically have hyaline cartilage. We also see a lot of it around the rib cage. Elastic cartilage is what we typically see in the external ear. Fibrocartilage is located in between the vertebrae of the spine. Your skeletal system is composed primarily of bones. Bones are a type of connective tissue that has calcified. They are highly vascularized, meaning they have a lot of blood vessels going into them. They're also innervated, meaning they are supplied with nerves. You have two types of bone. One is called compact bone and one is called spongy bone. The function of your bones is to provide support and protection. They also allow for movement. They are attachment sites for muscles, soft tissues, and some organs. Hemopoiesis is going to be the production of blood cells and platelets in bone marrow. Your blood is actually produced inside of your bones in the bone marrow. It's a good reason why they're very vascularized. We also store minerals and energy reserves inside of our bones. Calcium, phosphorus, and lipids are all stored there. There are 4 classifications for bones. Long bones. This is the most common shape. Think of a humerus or a femur. If you ever watch a movie and someone picks up a bone and uses it as a club, like a caveman, that was probably a long bone. Short bones have a length nearly equal to their width. We see those in the ankle, for example, or the heel. Flat bones are flat, shown here is the sternum, but they have a lot of sites for muscle attachment. Irregular bones have complex shapes that don't fall into any of their categories. When you look at a long bone, the middle section where it narrows is called the diaphysis. The inside of a long bone has a medullary cavity. You're going to find a lot of blood vessels inside of this cavity, and as you get older, you start to store fat there. The diaphysis, the narrow portion of the bone, provides support and strength. The outer ring of it is made of compact bone on the outside with spongy bone extending inward. The medullary cavity in the middle contains the bone marrow. The ends of the bones are called the epiphysis. There is a proximal and a distal one. The proximal end is towards the abdomen. The distal end is away from it. This bone is a humerus in your arm, so the proximal end is going to be towards your shoulder, and the distal end is going to be towards your elbow. Coating the end of our bones where it meets with another one is going to be the articular cartilage. Your epiphysis is composed of a thin outer layer of compact bone and an inner region full of spongy bone. Because of that, does not have a medullary cavity. The articular cartilage is hyaline cartilage. It's there to reduce friction and absorb shock. That way you're not having bone-on-bone contact at those joints, which over time would wear away your joints. It's actually what can happen with arthritis. If you can lose a lot of that cartilage, it's just bone-on-bone contact. There's a little space in between the epiphysis and the diaphysis called the metaphysis. This little space is where the bone was actually growing. The epiphyseal plate is a small line visible running through the middle of the proximal. The metaphysis is mature bone between the diaphysis and the epiphysis. The epiphyseal plate is a tiny layer of hyaline cartilage in the metaphysis. This little layer of cartilage gives us the lengthwise bone growth. It's how you get taller, actually, is little tiny cells get produced in the hyaline cartilage layer, and it's going to push itself a little further away from the other side. When you get older, this line eventually closes and your bones no longer have lengthwise growth. All bones contain a blood supply because they are highly vascularized, especially the spongy bone. Our arteries all have little blood vessels that go into the bones themselves, which we're supplying nutrients to everything inside of the bone, but we're also having that blood production as well. They also have nerves, mainly sensory nerves. The outside of a bone is covered with something called the periosteum. You may not have seen it before because if you ever look at a skeleton, or representative skeleton, this periosteum is removed. It is an outer fibrous covering. Very strong fibers basically anchor themselves to the bone. That way, the blood vessels can weave themselves through the periosteum and be held in place. It's also the attachment site for ligaments. That is the outside of the bone. The inside of the bone, the area that opens to that medullary cavity, is called spongy bone. And on the inside, the endosteum lines the inside of the medullary cavity. And it contains cells that we call osteotype cells, or bone cells. So whenever you look at a long bone, the outside is the periosteum, and the inside is the endosteum. The medullary cavity is present in long bones, in the diaphysis. They are not present in flat, short, and irregular bones because they only have an outer compact bone surrounding an inner spongy bone. In your long bones, they do have spongy bone at the two ends. Spongy bone is named because it really does have a spongy appearance. Now, what is going on with that bone marrow? Bone marrow is soft, sponge-like tissue located in your medullary cavity of long bones and in spongy bone. It is the site of hematopoiesis. That's where we produce blood cells and platelets. Our blood stem cells are actually found inside of our red bone marrow. That's where you're producing your blood. Whenever you're born, an infant, so 0 to 1 years old, you have red bone marrow throughout your entire diaphysis. and even up into the epiphysis. As you get older, you start to have a little bit of lipid storage in the ends and the medullary cavity. This is called yellow bone marrow. Adolescent and adult. So you and me right now, we have bones that are full of yellow marrow instead of red marrow. It's not geared towards blood production anymore. Now it's geared towards lipid storage. Yellow bone marrow is specifically used for fat storage. Your blood stem cells become inactivated and turn to yellow marrow as you age. Small amounts of red bone marrow remain even in adults, but there's not nearly as much as you were when you were a child. This picture shows us compact bone on the outside, that would be on the diaphysis or the shaft, with yellow marrow inside of the medullary cavity. Then we get larger towards the end, so it looks like that would be an epiphysis. If you needed to get blood stem cells out of a bone for some reason, you can do that by taking a large needle and actually going into your pelvis bone and taking a small sample of the bone marrow. It's a little scary. On the right is a picture of the bone marrow of a long bone that has been cut in half and is going to be used for soups. Apparently, because of all of that lipid storage and blood production, bone marrow is actually wonderful for soup. I haven't tried it, but enough people have said it's true for me to maybe believe it. Now, if someone needs a bone marrow transplant, that means that we replace blood stem cells in a patient with healthy cells. If you have diseased or damaged bone marrow from cancer, radiation, or an infection that got inside of the bone, the only way to fix it is going to be taking stem cells from a donor blood or bone marrow, healthy stem cells that whenever you put it into the patient, it begins to replicate and produce healthy blood cells. But it has to be a perfect match or the body will reject them.